The number of new cases of COVID-19 in South Korea continues to come down overall, but with millions of people set to travel for the Korean Thanksgiving holiday, Chuseok, this weekend, the authorities have announced measures to ensure people can easily get tested and treated. There'll be test centers at highway rest stops and more hospital beds set aside for people at high risk. Jeong Eun-joo reports.
South Korea is raising its guard against COVID-19 ahead of the upcoming Chuseok holiday. Mass migration is expected nationwide during the four-day holiday, with millions traveling to see relatives. To prevent the virus from spreading further, health officials on Wednesday laid out tailored virus prevention measures.
We have made it possible to quickly and easily receive COVID-19 tests nationwide. Public health centers, screening centers, and temporary screening centers are also open during the holidays.
The KDCA said that COVID-19 testing will be temporarily possible at highway rest stops across the country for 4 days starting from Friday, when the Chuseok holiday begins. 9 of the busiest rest stops were selected. The Seoul-bound section of the Ansong services, as well as the Hanam-bound Icheon services, will be among them that have temporary COVID-19 testing stations. The KDCA also says a total of 6,000 one-stop COVID-19 treatment centers will be operational nationwide throughout the holiday. At least 700 will also be open on Saturday, the day of Chuseok. People will be able to be tested, receive in-person medical attention, and get a prescription at these centers. For regions without these one-stop treatment centers, public health centers and emergency rooms will be able to prescribe antiviral drugs. Some 3,500 pharmacies across the country will be open on Saturday. The government will secure over 4,000 sick beds for those considered as being at high risk, such as children, expectant mothers, and dialysis patients, and create a task force to monitor the health of vulnerable people, such as seniors living alone. Medical consultation centers offering non-face-to-face treatment will run around the clock.
The government will operate an emergency response system during the holiday period, continue to monitor the current situation, and prepare thoroughly.
Meanwhile, South Korea added 85,540 new COVID-19 infections on Wednesday. There were 56 COVID-related deaths and 521 patients are critically ill. Jeong Eun-joo, Arirang News.